Good afternoon, everyone. Thank you for all of you who have joined our live sessions today. Please bear with us for a while we wait for other participants to come into the room, and then we shall start in a while. Yeah. So meanwhile, just sit down, relax, and enjoy. We are going to start in 1 to 2 minutes time. Okay, let's start. Welcome to Soe as well as Dr. Salim. Hello, Soe. How are you?
I'm good, thank you.
Very good to hear that. Hi, Dr. Salim. Are you there? While waiting. What's everything at your
Mhm.
side? So everything's good?
Good, very good.
How,
Today
how are both
is
of your
a
boys?
they're doing very well. Today is a very special day indeed for us.
Oh, really? What day is that?
It's our 15th wedding anniversary today.
Oh, happy
15th
anniversary.
Yeah.
anniversary.
Thank
Wow,
you.
congratulations. Such a coincidence. Actually, when we set this event for this particular date, we didn't realize that today is actually the your wedding anniversary.
Yes, I actually forgot. I mean, I overlooked. Sorry. It was
Wow, such a
it was
special
my
one.
husband who reminded me, and I'm really, I know that I'm really blessed because usually it's the other way around.
All right.
Yeah.
So, but okay. So I suppose usually for wedding anniversary is supposed to be the day you celebrate together as a family. So
Mhm.
thank you very
Mhm.
much still for you to give a little bit of your time for us and join us in this session. So it's to be ignite us with more information, especially
Sure.
in this area of genetic diseases. And
Thank
today
you.
in the room also we have Dr. Salim. How Dr. Salim? How are you?
I'm good. How are you? Thank you very much for this forum.
Yes, thank you to you too. So today you are going to feed us with a lot of information on genetic encodings. So I think all of us should prepare, yeah? Okay, so a very good afternoon also to all of you who joined us in our live sessions today. It's a very rare opportunity for us. And for me personally, to pick on this particular topic, especially on genetic diseases, is really, really challenging because it is actually a very complex and I find it is very difficult to understand. And today we are blessed to have these two persons. One is Soe and also Dr. Salim. So a very brief understanding to everyone. Miss Yap Soe, she is actually a mother of two boys. One of it is actually a spinal muscular atrophy patient. This is a special condition that is affected due to the hereditary genetic diseases disorder. Yeah, and with that also that sparks Miss Soe to co-found Care Journey, an organization that help to spread the awareness on spinal muscular atrophy or SMA, as well as giving the support to the community. And I personally feel I'm really impressed by your tenacity, your maternal traits that really fight all the way just for your
Thank you.
for your kids and also for your family. I really salute that. And okay, so on the other hand, I also have Dr. Salim, the laboratory director of Genomics Lab, that is specialist in this genetic screening located in Kota Damansara. He was actually also an ex-lecturer of University Science Malaysia, teaching all this genetic stuff that sounds really, really uh, is actually a UFO, lah, unidentified object in our brain over here. So today, please feed us with all this information. Now I'm going to start. Okay, before that, I think it's good if let's say Dr. Salim, you can give us a brief understanding on these genetic diseases, because there's so many what do you call it, statements available outside that I think some of it is actually not right. It's misleading, and not all is actually hereditary. Some could be affecting the chromosome part, which may not be the right one. So may I get your explanations in this area, particularly in genetic diseases?
Okay, thank you very much. So what I'm going to do is I'll just give a very, very brief overview of the genetics. I'll just try to make a brief overview. Yeah. So human has got 23 pairs of chromosomes. Yeah. So females have got 23, males have got 23 pairs, but the only difference between male and female is that male has got this naughty chromosome called Y chromosome, and in female you have two copies of X chromosome. That's the only difference between male and female. I call it naughty because we do a lot of mischievous things around, yeah. So it's responsible for Y chromosome, yeah. So of these 23 pairs of chromosome, all these chromosome have got a lot of genes in it, and for chromosome 1 being the biggest gene, it has got the most number of genes. Like chromosome 1 has got 1961 gene. The Y chromosome has got about 63 genes. Chromosome 2 has got 215 genes. So these genes are distributed all over the chromosomes depending on the size. Some are more compact with genes, the others are less compact with the genes. Yeah. Of this, we know that there are about 25,000 protein coding genes, and so these protein coding genes are making our behavior, how we behave, how we present, how our body functions, how our biochemical mechanism functions, how the color of our hair looks like, eye, and all those height, and all those things are controlled by these genes. Yeah. So the other part of it is the looking at the abnormality. So the abnormality can be broadly divided into chromosomal level abnormalities and also the gene level abnormalities. So chromosomal level abnormality, when I say that, it means that we have two copies of chromosome 21, for example, but you have accidentally inherited three copies of chromosome 21. That will affect and present you as a kind of Down syndrome. If you have three copies of chromosome 18, you will be presented as Edward syndrome, and most of these Edward syndrome cases are not compatible with life. And many of the chromosomal level abnormalities are not compatible with life. But chromosome 21 is compatible with life, and some people have some level of quality of life, but it creates a lot of burden to the family, and also the quality of life of the child is really challenging to the society. Yeah. So, yeah,
So meanings that at the chromosome level, when it is affected, one of the example is the Down syndrome. Now, is this
that's
Down
right.
syndrome a hereditary one?
No, it is not hereditary. But some people are carriers of chromosomal imbalances. We call it chromosomal imbalances, meaning that chromosome 21 may be sitting on chromosome 18 and fused together. So in that case, sometimes it can be that family may have more chances of having Down syndrome babies. Okay, but in generally it is because of your age. People who are more than 35 years of age have a higher risk of having Down syndrome babies than a young couple who is about 25 or 28 years of age. Similarly, it goes with Edward syndrome, Patau syndrome. All these chromosomal level abnormalities are really the risk of having an abnormal child with chromosomal imbalances increases with your age, especially the maternal age. Yeah.
Okay, so that's for the
Yeah,
chromosome. Then
that's
we
right.
will proceed
So
into the other
second
area.
is the mutations in these genes, because each gene has got four bases arranged, A, C, G, T, we call it in simple. So any mutation happening in a wrong area can cause a malfunction of the gene, meaning that the protein is not produced, the mRNA is not produced well, or even if it is produced, it may not be functional. you know. And one of the common example will be beta thalassemia, which is very common in Malaysia. It's about nearly 4%. In some population in Sabah Sarawak, it's more nearly touching about 7 to 8% in that group of population. The other common example is SMA, spinal muscular atrophy, which is also not rare in this population. Yeah, and these kind of diseases are inherited, and most of these we call it autosomal recessive or autosomal dominant disorder. Recessive means both husband and wife have to have the same mutation in, at least mutation in the same gene. Let's say you are a carrier of SMA, spinal muscular atrophy, and your husband is also a carrier for spinal muscular atrophy or SMA, SMN1 or SMN1 gene. If you both are married and you're planning a child, there's 1 in 4 chances that in any given pregnancy it could be affected child, meaning that both copies of the SMA will be SMN gene may be affected, and therefore it may cause a lot of uh, uh, the gene becoming non-functional. So these kind of things we see. You and I may be very healthy. We don't have any phenotypic expression. We live a very quality life. But I am a carrier of beta thalassemia. You wouldn't know by looking at me. I do humanly things. I do play football. I do cricket or whatever it is. I do all the social events. But I'm perfectly normal. But if I accidentally marry to a thalassemia carrier, or if I'm an SMN mutation carrier, and my wife is also an SMN mutation carrier, then in every pregnancy in me and my wife is having, there will be 25% chance that it is an affected child. 50% chance maybe it is a carrier, and you have only 25% chance of having a healthy pregnancy in any given pregnancy. So the important message here is that we may be looking quite normal and healthy and do all socially active things, but you never know that you may be a carrier for some debilitating disorder. So that's why we always advise people to look at your extended family to see whether you have an affected child in extended family or in your immediate family, in your siblings or some. Yeah. If you have to screen yourself to see whether you are a carrier. I will
Mm.
focus more only on thalassemia and SMA because these are two common diseases that are very fairly common in the population here. And SMA is a disease we really neglect, but it is not that low. We have to give same emphasis that we are giving to thalassemia for SMA also. Yeah,
Mm.
yeah.
I believe in this topic, Miss Shui, definitely you can relate it to your own very personal experience. Like what just now Dr. Salim said, like thalassemia and also SMA is actually pretty common in Malaysia. And often maybe thalassemia is more well known by people, but not really on SMA. Even like for me myself, also got to know about this SMA when I met you. So it personally,
Mm-hmm.
honestly speaking, for me, I thought that it is just a rare diseases that I don't think this will happen very often. But then apparently there's quite there are quite many here, especially in Malaysia. So Sogi, I just would like to hear from you, like what Dr. Salim mentioned. If you were to look for your life partner and you coincidentally meet with the one that also have carry the same genetic conditions as you, then you have the chance of passing on it to the next generations. Now, for you personally, at that time when you were dating, the time were you aware about that? Did you know about that? And do you have
Mm.
any traits in your family that someone is having this SMA?
Okay, so let me share our story. We are very 15 years ago before we decided
And
to
today is the
tie the knot
anniversary.
today. Yeah, Emin and I, we actually went for a carrier test with our gynae. That's because
You
we
knew that you had that. You knew it.
no, actually thalassemia in Emin's family and Emin himself, he is a carrier of thalassemia,
Oh.
and therefore I went for a test. So it was confirmed that I'm not a carrier, and that's fine. So we went on to tie the knot, and a year later, I gave birth to my eldest son, Jaden. He's 14 years old right now. He has no, I mean, just typical like any other child and all that. And 3 years later, I gave birth to Brandon. He was normal when I gave birth to him. he had some complications with his lungs, which is pneumonia. We didn't think any differently about, the child has any kind of genetic disease or any kind of condition, but we were told to make sure that we take care of him actually, especially his lungs. And it was okay until um, 6 months later, we noticed that he doesn't roll over. He was not a typical child like his brother. He was missing a lot of milestones. For example, he doesn't cry that loud. His cry was always very soft, and his neck was very weak, and he couldn't even crawl. In 6 months, he didn't attempt to crawl. That's when we noticed that he has um, challenges. And after that, we actually did 6 months of physiotherapy. We saw two
Months.
pediatricians who told us that let's wait and see because boys usually develop slower. So we did 6 months, and by 1 year old, I noticed that he wasn't thriving in terms of his weight, and therefore we actually did a genetic test, and it was confirmed that he has SMA type 1.
Oh, that's I would say that there are some golden time missed at that time. If only that diagnosis would be able to be diagnosed earlier, we probably could do something different. So you only managed to diagnose the disease after he is 1 years old.
Yes, because we did the diagnosis. In fact, we were very fortunate actually. We didn't go through a lot of hassle in terms of getting him diagnosed because when I got to know the community, I've heard so many stories about family getting very late diagnosis, especially in the
Oh,
past. Like if you dial back 10 years or 15 years ago, families had to go from one hospital to another hospital, from one doctor to another doctor to just find out why is their child not walking, why is their child so hypo Tonya, like we call it the drag, uh, that baby, very weak and all that. And through a lot of muscle biopsy and all that, then only they find out. So 10 years ago, when Brandon was diagnosed, when he was 1 year old, we were very lucky. All he needed to do was to take the blood test, and the geneticist told us what is to expect. He checked the family history. Both sides has no cases of SMA, and yeah, I mean, we were very blessed that it was quite an easy diagnosis.
I see. So from your side and both, and also from Edmund's, your husband's side, none of your family members has this SMA.
No.
None. That's why you never suspect anything of it. And
Yes.
okay. So when you went to see the doctor, never came into your mind also until the thought of having it tested. It was on your own initiative, I believe.
Yes, when a mom, always tell the mothers, trust your instinct.
Right.
When your child is not thriving and all that, and nowadays you have Mr. Google, you can just Google and ask the questions. And the list of diseases that came out in that, when I Google, why is my child not thriving in terms of weight? Why is my child not crawling, walking, or attempt to walk? That list of disease actually shocked me. And that's when I pushed my pediatrician. I said, we need to do some tests.
I see. So that test was done by a company that is available in Malaysia. You don't have to go all the way, send the sample all the way to overseas. Or
No,
you,
I don't think we did. We did it in a hospital here and by geneticists.
right, I
And we got
see,
the
I see.
result in 1 month's time.
Okay. So I believe it must be such a devastating state when you got to know that.
It was shocking. I think that when a geneticist told us about the diagnosis, I always say that how the geneticist or how a professional doctor convey the message to the family is very important. I still remember the date. It was August 15th, 2011, and every single word that he muttered, I would say that we remember everything, the feelings of it. You are like being dumped into a cave. When he asked, "Do you have any questions?" We actually went prepared with a lot of questions, but hearing that diagnosis and really accepting it, you wouldn't be able to diagnose. You wouldn't be able to think straight at that time, especially when the doctor tell you that your child has only 1 more year to live. That is shocking. We can accept that he won't be able to walk. we can we can accept any kind of what, but when it's terminal like that, and when they tell you there's no cure, just take him home and spend more time. That that
Mm.
that makes a very big that kind of feelings. It's just you can't describe it. Yeah.
Yeah, definitely, definitely.
Hmm.
So, oh, it was quite bad that the doctor had to tell you that you apparently had 1 year time for
Hmm.
Brandon.
Because
Uh,
that's typical for SMA type 1. So in SMA, there are four types, four to five types, type one, two, three, four. So type 1
mm,
is the most severe. And before before there were any treatment available, usually type 2 children pass away. Sorry, type 1 children pass away before they are 2 years old. Yeah.
mm.
And that
But
was. Mhm.
but today Brandon is already way past that 1 year old time, and he is today is like what
11.
12?
He's
11.
11 years old. Yeah.
Yes, he's 11 today. So that's why I'm so impressed by all your fighting spirit. So just share with us, how did you do all that? How did you manage them? I believe there must be a lot of challenges, especially with this SMA, where earlier I heard Dr. Salim said that a lot of attentions are not being put on SMA compared to like thalassemia, where a lot of people are already aware
Mm.
of it.
Yeah, it
So,
was definitely very difficult to find another family. When we asked the geneticist, is there any family that you know? Because of PDPA, and geneticists say I can't
oh,
reveal
yeah, right,
any
right.
families to you. That was very difficult to hear. What we want to hear is like to see another family who have done that. Been there and have experience. What we did was immediately Edmund actually went into look for a lot of information on in the internet, and we found out that that is not the case. In USA, we have even adults who are type 1s. They live way past beyond 2 years old. So with that, we actually went on to do more research. Edmund went on to do more research, and then we actually found another family through Facebook. I think about 1 or 2 months later, and we managed to keep in touch. And our friend, she is type 2, very strong girl, and she's now also an adult living in London, and she's
Oh, wow.
graduated from University of Cambridge. And that is the hope that we want to see. And as a family or as a caregiver, this is the hope that we want to tell people, that it's difficult but it's not impossible.
Okay. For the sake of the audience over here, maybe Soki, you can also, I believe you have a good understanding on SMA. You can help and enlighten us. What is this, these conditions of this SMA actually? How it affect the kid actually?
So it affects the baby from a different spectrum. Like I mentioned earlier, type 1 is the weakest type. Type 3, type 1 are the ones who are not able to sit without support. Type 2 are the ones, their last ability was to be able to sit with and without without support. And type 3 is the ones who have walked before. So it does happen in teenagers or even in adults. Yeah. So for type 1s, they are usually have a lot of challenges in terms of respiratory issues. They succumb to pneumonia most of the time. Basically, in across all SMA patients, respiratory issues is the most important. To
Mm,
be able to manage that well is it determines the well-being of the child. And of course, physiotherapy is also very important for the children, because you have to be able you must use all the muscles, okay, to make it, to keep whatever that you have, to avoid it being wasted. And
mm,
mental health, for children, I mean for the patient and especially for the caregiver, is very very important, because
right.
it's a very challenging journey. It's very challenging experience. Being hospitalized is one of something very common for children, and nutrition is important, because most of the children at very young age, they do not thrive. Even with the current treatment that is available, one of the issues which the children of babies are facing at a very young age is being able to put on weight. And nutrition has to um, be looked into, and therefore the children are giving the options to be tube fed or having a pack on the tummy. So we actually, they're multidisciplinary. There's so much, and then as they grow, we have the issue of scoliosis, where Brandon is having a at this age, at 11 years old, his growth spurt. We are noticing that his spine is his muscles are not strong enough to hold his spine, and therefore he's developing kyphosis and scoliosis. And then in the next journey, it's, do we want to do the operation and things like that. So that's a long journey. Yes.
Definitely, and it affects different aspects from your
Yes.
moral, mental, economical, your financial,
Yes.
etc.
Yes.
Yeah. So back onto this, Dr. Salim, I would like to ask you a question. For I mean, like for the cases like Smith Soe, um, suppose if let's say a couple would like to start or do family planning, what can you suggest? What can they do in order to prevent or to find out or assess earlier this kind of thing, and so as to prevent it from passing to the next generation?
Yeah. So first thing first, when you're planning a child, make sure that you get a family history of what is going on in the family in terms of genetics, and it's always good to get a blood test done because see, thalassemia is common in everyday term. We talk about thalassemia. When you visit a gynecologist, they will do a blood test. From the blood test, it's very easy to spot whether you're suspected for thalassemia. But diseases like SMA is very hard to there's no blood test, simple blood test that routinely does to screen these kind of genetic disorders. So you have to take a specific test for genetic disorder. So what we are promoting is, if you're planning a family, it's always good, because the reason why I'm promoting this is, see, whenever we meet a couple, they are always talking about whether my child has got Down syndrome or not. The first thing is, my
Mm.
child has got Down syndrome or not. So they will be screening. They visit a gynecologist. They get the NIPT done. So, see, the general population, the risk of having a Down syndrome baby is 1 in 600 or 700. Yeah. But the monogenic disorder, the risk of, or the incidence of having a monogenic disorder in the population is about 1 in 600. Is much higher than the Down syndrome risk. It's much higher than the Down syndrome risk. It's about 1 in 600 to 650. You never know that you and your wife is a carrier for some genetic disorder. So to avoid that 1 in 600 risk, if you are taking a Down syndrome seriously, you have to take genetic disorders also equally important, because the risk of having a genetic disorder baby is much higher than having a Down syndrome baby.
But
So
the
that's
problem currently, Dr. Salim, in society, there is a lot of misunderstanding. Like you see, a
mm,
lot of people will be asking you, "Will my baby having Down syndrome?" Because we
exactly.
thought that is the genetic problem that occur,
Mm,
which we
mm,
definitely do not want it to happen in our life. But
mm,
little do we know that actually we have these hereditary, so-called monogenic disorders that could be
mm,
run in the family. That you see, like in the case of Miss Soe, she herself, including her husbands also, none of them actually runs in their family, you see. So
mm,
never people never realize about it. The
mm.
limitations of this knowledge in the society is there.
Hmm.
May,
Yeah,
Correct.
that's
may
what
I
I'm
say
saying. So
something?
nearly
May I
about
say
6,000. There are sorry, just well defined about 6,000 monogenic disorders are there. Well defined 6,000 monogenic disorders, and these disorders are mainly responsible by 4,000 over genes are responsible for this about 5,000 or nearly 6,000 monogenic disorders. So having a risk of 1 in 600 is really a high risk that you don't want to gamble. So that's why I'm saying, you, before you plan to have a pregnancy or have a child, go and screen yourself, because many labs are now offering expanded carrier genetics testing, which looks at about 400 or 500 or 600 genes, and then look at the risk of you having a child of an abnormal. That includes SMA, G6PD, thalassemia, cystic fibrosis, you name it. The common disorders that we have on a daily basis, we are screening them on a single blood sample. So this takes about like 5 to 10 days to get the report back to you. Not like about 10 years ago, we have to wait for 1 month to get your report back. Now it's about 2 weeks. You get your report, a single blood sample that checks about 400 or 500 monogenic disorders, and give a risk assessment to you whether you are susceptible or have the risk of having affected child. You know. So with that information, you can plan your pregnancy, or you can plan your family with the knowledge of the risk that you carry. You know.
Mm.
Yeah,
Yeah.
I like to add on to what Dr. Salim has mentioned. For SMA, 1 in 50 is a carrier,
Hmm.
which means in a national school size classroom, there is a possibility of one child has that carries a defective gene. 1 in 50. In thalassemia, there will be one in, I think, 20 or 30 in
One in
Malaysia.
20. One in
One.
20.
1 in 20. And in can you imagine now SMA is 1 in 50, but the knowledge among the public is not there. Because when I talk to
Exactly.
people, I would think that 9 out of 10 would have heard of thalassemia, but none of us have heard of SMA. But the carrier rate
Mm.
is 1 in 50. And if you take the birth rate in Malaysia, estimating it at 500,000 babies born every year, we are looking at 50 to 60 babies born every year. And
That's right.
where are these 50 to 60 babies? In the last 4 years, in the last 5 years since we established We Care Journey, we actually found, one, I would get usually 1 or 2 calls maybe in 3 months. Now I'm getting 1 or 2 calls every month from doctors and from friends who refer to us. Hey, could it be? Doctors will tell us, these are some patients here. Please reach out. But friends are telling us, hey, my friend's kid is having this. Could it be SMA? That is the amount of awareness that we want people to think that could it be, so that you reach out, because the family support and the support from all the stakeholders is very, very important, to
Exactly.
know where to find the resources, to know what kind of support is um, that is out there in Malaysia right now. It makes a lot of difference to the family who is affected.
Yeah. To add to that, when you say 1 in 50 carrier, that means if you look at the probability of two SMA carriers getting married, meaning it's one in every 2,500 marriage that happens in Malaysia will be between two SMA carriers.
Mm.
Yes.
Yeah.
And
It's
also we have also families who have more than one child affected by SMA, because
more
That's
than
right.
one.
with
Um,
every pregnancy there's 25% chance of having a child with SMA. We also have families who have more than one child with SMA.
right. And probably like to add up to what Zoe you mentioned, because of the mortality, probably some child could be probably just didn't make it. Right.
Yes, yes,
I believe that
yes.
happened.
Late
Yeah,
diagnosis, especially in the East Malaysia, it's very hard to be diagnosed. The
exactly.
support there is insufficient, resources is insufficient. And I would suggest that, if, let's say, for example, if you know that you have a niece or nephew, or a cousin, son or child has a particular genetic disorder, before you have start your family planning, get yourself tested.
Mm. But one thing also, first is the limitations of the knowledge. I mean, a lot of time we take it for granted. I think that happened, including for myself also, as I got married and I planned for having a child. Never crossed into my mind to have this kind of test. I mean, like, very thank God that both my kids they are all perfectly normal. But it probably not happen the same thing for other couples. So we don't have that kind of knowledge, you see. So the limitations of the knowledge is there. And secondly, also, I believe this kind of test is definitely not cheap. Hence, it's not like affordable for everyone to go for the test, especially you have to test for both the husband and wife, right?
Mm.
And
So, I
also,
mean,
yeah, I would
right,
also say that besides financial involvement there, I think genetic counseling is very important before we do any test, so that
mm,
the couple know what they are getting into. What if,
exactly.
you always ask yourself, what if, you find out something, and what is going to happen? So the relationship between the couple has to be very strong, and the understanding from the couple, if something is you get a diagnosis from the genetic test and all that, what do you do?
Yeah. So
So
now the
genetic comes,
questions.
yeah.
Now there come the questions to Dr. Salim. So if let's say a couple planning to tie a knot, they go for the so-called carrier screening, and they found out that let's say both of them are actually affected. What can they do? Can they prevent? Can they still continue? Or oh come on, we just can't get together already, and we just have to break off? That will be so devastating. So Dr. Salim, come on.
Yeah, well, if you're waiting for a chance to get separated, of course, that's a good news. But but if you want to get together and start a life, there are a couple of options available now. The technology has developed so much. One option is you get pregnant with that knowledge that there is a risk of 25% risk that the baby will be affected. In that case, you can do prenatal testing. By 14 weeks of gestation, you take an amniotic fluid sample, about 20 ml. It's not going to harm your baby. Things are perfect now. Those days, we call it 1% risk of doing amniocentesis, but that risk has gone down so significantly now. It's below 1.1%. So you can opt to do that. It's a cheaper option. But the question comes, what if it is positive? Are you going to continue the pregnancy, or you're going to
Terminate it.
think otherwise, or so the best option will be, if you have that kind of knowledge, go to an IVF clinic, do an IVF treatment, because we have the technology now to select an embryo that is disease free and chromosomally normal, and then you can implant it and the pregnancy will be perfectly normal. These two options are available. But of course, again, it comes back to the financial knowledge, financial. First, whether you have the IVF is not cheap; it's expensive.
Yep.
Yeah, but having a natural conception again is a risky, because if you think that you should go in that way, then you have to go and see a gynecologist, get an amniotic fluid taken by 14 or 16 weeks of gestation, and get that tested, and make sure that the report comes much earlier than 2-3 weeks, because you need to have time to decide on your pregnancy. Yeah. So
Right.
these are the two main options that are available. One is to um, get pregnant with that knowledge that you are dealing with a 25% risk, and manage with an amniotic fluid, which is called prenatal testing. And second will be the more costly one, but more comfortable one for general, I think, but it costs money, because we have the technology to take a small few cells from the trophectodome layer. That is, when the embryo grows to the day 6 or day 7, you can take some cells from the lining of the embryo, which is going to make the placenta. You're not going to touch the cells that forms the baby, but you're just taking the cells from the lining of the embryo and get it tested, and you can get a fairly accurate results from there. And so therefore you can select the best embryo, both morphologically, genetically, and then implant it for a successful pregnancy.
Right. So, just to summarize a little bit, so like a couple can do a carrier screening just to check if, let's say, they run this disease in their family or in himself, and after that, if let's say both of them found out to be positive, they can actually avoid that via IVF, where we can choose the embryo that is not affected in order to establish into pregnancy.
That's right. Yeah.
Right. Okay. But how is the chances like? Is the chances of getting the unaffected baby high or low? Are we able to determine
Um,
that?
it, it it depends on the number of embryos that you can get. It also depends on the age in which you are getting into IVF. If you're a 37, 38-year-old lady, probably the number of embryos may not be. You don't have a large number of embryos to work with. But if you're young enough and healthy, you will have a lot of embryos to work with, and the chances are extremely high. I would say in an IVF, good IVF setting like Alpha Fertility Center, the success rate is about 80%. So therefore, when choosing an IVF center, also you have to look at their record, history, their success rate, and all those things really matters.
Hmm.
Yeah,
And the other important that I catch from you earlier was to, if you could start it earlier, then your chances
Hmm.
is actually higher.
That's right. Yeah.
Okay. And Dr. Salim, there's one thing I picked from you earlier about this NIPT test, which I
Hmm.
understand it is the non-invasive prenatal test. So, like someone who is already pregnant, they can do the NIPT. Now, at the same time, does that mother need to do the NIPT on top of that with the carrier screening, both combined
Ye-
together?
Yeah, they could do both combined together. That's right. That's an important question. So, the expanded career screening is can be taken at two levels, mainly premarital, to see whether you both are non-carriers for the same gene mutations, and if you decide to go ahead with your marriage and then you don't know that you are a carrier for something, but later you discover that my wife's family has a history of so and so. If that is the case, and if you think that you should check, when you take NIPT, you can take a blood sample at that time and check yourself to see whether you carry a mutation that should be worried of. So both can be done together. Yeah.
Hmm. So it's recommended to be done together,
Yeah, it
where they
could
are
be done
testing
together. Yeah,
different things, right?
that's right. You're looking at the chromosomal level through NIPT, but at the same time, you're looking at the mother's genomic DNA to see whether you are a carrier for some genetic disorders. But
Wow.
there are new technologies coming in. We call it NIPD, non-invasive prenatal diagnostic testing, and some labs are now offering a non-invasive screening to see whether the baby is affected with SMA and also thalassemia. But in our lab, we are offering for alpha thalassemia now non-invasively to see whether the baby is affected with alpha thalassemia. But there are few labs overseas that are offering non-invasive testing to see whether the baby is affected with SMA.
Hmm. Okay. And I would say that generally for these genetic diseases, they are no cures for it, or
Yeah,
some.
the best way is to really manage these cases, and really it gives a lot of um, mothers and fathers have to be really very strong to manage these affected babies. But
Just like
many times,
cesarean
yeah,
happen.
yeah, it's a very good example, and the whole Malaysia knows her very well, I think. So, but there are instances where when you have affected baby, you really neglect that baby, you know, and it's really sad to see some of those cases coming across.
Yeah, they're being rejected. Right.
Mm.
Yeah, I like to
Mm.
say that mental health. We Care Journey did a report recently. It is called Living with SMA in Malaysia, which is to find out what is the burden of the disease for the family. And what we found out is mental health is the most challenging for the patients and the caregivers. For the caregivers, because this is genetic, one of the area that the family feels, especially maternally mothers, because it's genetic and because of the culture and the religion belief, mothers are
Mm.
usually the one being at fault. Sadly,
Mm.
but this is true. All right.
Yeah.
And that burden is taken by the mother, and at the same time, a mother has to also care. Is always most of the time is the main caregiver of the child, right? Most of the time, the mother has to give up whatever career aspirations that one has, or to actually do the best that we can. So when we have family support from other families and family support, and to work with the doctors, to work with the policy makers, to make and manage, like what Dr. Salim said, there's a lot to do in managing the disease, in managing the condition, because there's no cure. There's probably therapies. So SMA is very blessed to have three therapies at the moment, and there are a certain number of kids now that has been given the therapy under compassionate use. However, we are still advocating for the treatment to be reimbursed by the government, so that more children and more adults can be treated, because there is a lot of things um, that, if let's say prevention can happen before family planning, or even before a child is born. At the same time, if we treat the children right now, there's a lot of benefits to the government.
Yeah, definitely it will make a lot of difference.
Hmm.
Dr. Salim, I have a questions over here that ask for the cost for that test that you mentioned about that 400 to 500 conditions, genetic conditions that you mentioned earlier.
Yeah, for couple it is about 3,000 ringgit, but if you take individual, it'd be costly 2,500. For couple, we are giving for 3,000. So
Right,
it is looking at 450 over genes, and including the SMA, thalassemia, G6PD, fragile X, and all those common diseases that are in the local population, and also in the Southeast Asian region.
right. How long is the turnaround time?
It's 10 calendar days.
10 calendar days. So via
That's
blood
right. It's a
sample.
blood sample, correct? Yeah.
Right. So we can walk to your laboratory to do that, or we need to go
Um,
to.
we because we don't have genetic counselors in the lab, so before taking this kind of genetic testing, as mentioned earlier, it's extremely important to have a session with at least a genetic counselor or a clinician to discuss what are you getting into, and what is the expected results, and how, if it is positive, how you're going to manage your family or family planning, those kind of things have to be discussed before taking the test. Taking the
Mm,
test is easy, but getting into this large number of information and
yeah,
managing that and absorbing and digesting this is really, really important. So before taking the test, it's good to spend about 10-15 minutes with a clinician or somebody who can discuss the probable outcome of the test. It's
mm,
always good, yeah.
right, right, okay. And we also
In
have a call. Yep, sorry, go ahead.
Yeah, in fact, We Care Journey works very closely with a team of genetic counselors. One of our the society that is formed is called Genetic Counseling Society of Malaysia. So you can actually reach out to us, and then we can connect you with the genetic counselors. This team of genetic counselors who can
Yeah, that's
actually
awesome.
help. Yes.
Right, right, right. That's really, really awesome. So definitely give a very good support on that. Next, we have a comment over here that it will be a good idea to educate gynecologists the importance of getting tested. And she thanks Dr. Salim for
Yeah, we
sharing
we
this.
are going around doing a lot of CMEs because we also felt that genetic education is something that we have to, especially the senior doctors who during the medical school, it's kind of a neglected area. But
Yeah,
current graduates are quite educated with genetics, and they have updates on genetics. But we felt that probably it's because of the cost of genetic testing. It's not a wide practice in clinics to order genetic testing unless you have a symptomatic baby, or unless you are presenting with some clinical disorder. But having said that, we are going around and organizing small CMEs with consultants to discuss about the genetic conditions, our experience, case discussions, so that they will be updated about the current technologies, current diagnostic approaches, because now medicine is becoming evidence-based medicine, and also on top it is becoming personalized. So
mm,
when you talk about personalized medicine, you're talking about your genetic makeup. So yeah, we are doing our a little part of discussing with the clinicians to educate them, and also at the same time we also learn from them about their clinical cases that they have, and develop our own test availabilities also.
yeah. The public definitely need this kind of informations, and we
Mm.
definitely need the help from the provider that the laboratory where Dr. Salim you are, as well as the organizations like SOE you are leading, to give a lot of information to the public with regards to these matters. Then with this also, I would like to ask also for Sogi, do you have a message that you like to convey for these parents who has kids affected with that, or even themselves are affected with these genetic conditions?
Um, a message. I'll just share my experience.
Certainly.
Yes. I think as like any other parents with a child who's affected with any kind of conditions, we are always not prepared. No one is gonna be prepared for this kind of things. Even if you are prepared, when, for example, like myself, when I look at the list of diseases that could my child could have, I had a shock. But when the diagnosis come and it really happens, that kind of feeling is it's very difficult to summarize, and it's a long journey. However, never give up hope. Always remember that there are resources out there. Get ourselves information. My husband and I always believe in giving our community or even to the public informed choices. There are always choices to be made. So, with that informed choices, you can make decisions based on your family situation, based on your own family resources, how
Mm,
you can manage, how is the family dynamic, and all that. There is no right or wrong. Don't
mm,
worry that you'll be judged. Don't worry about what other people say. Everyone means well when they say something or they want to help. But sometimes, as a parent in that situation, sometimes we are so in it that whatever the other people say, we may think of it very
yeah,
differently, right?
exactly.
So reach out to your friends, to any NGOs that support your particular condition, and continue to work on your mental health. Take care as a caregiver. Take care of yourself first.
Then
Really,
only you can
I've
take care
been
of
through that.
the
I've
people
been
who are
through that,
affected.
yes. And
Exactly.
it's a very heavy price to pay because when a child is affected, it's not just the child that's affected, it's the whole family.
The
It
whole
takes a
family.
village to raise a child. So,
Yeah.
yes, you have to take care of yourself as a caregiver first. Then you will be able to do a better job in terms of keeping the family.
And the strong support from both husband and wife. Believe this
Yes,
is the utmost important.
yes.
Yeah.
And reach out, always ask for help because I always believe people want to help but they do not how to help. And in our Asian culture, we are always very shy, like, do I ask or
Yeah.
do not ask? Or some
And
of
then
them
and
are,
Asian culture also we will feel that why do I have this kind of child that they will keep it as a secret at home? They don't want to
yes,
bring them out. They feel
yes,
that it's so shy to show them around. It's
yes,
Asian culture.
yes. So
Yeah,
reach out and tell
unfortunately.
people how you want to be helped. That's very important.
Right, right. Okay. There is this one question that I missed out earlier that is asked, does PGD IVF result in twins or triplets? So maybe Dr. Salim, you want to help us a little bit on
Sorry, I
that.
couldn't understand. I couldn't understand the
Does
question.
does IVF with PGD result in twins or triplets?
Oh, okay. You know the amount of embryos that you are.
It's a common taboo or a common understandings that the public get. Oh, you do IVF, then you will have a twin.
Not necessarily, no. You know the amount of embryos that you are implanting. Each embryo is managed, tested individually, and each embryo is labeled separately with an unique ID number. And you know how many embryos you are implanting. So depending on the amount of embryos that you implant, the pregnancy will depend on the amount of embryos that you implant. Yeah.
But there are chances also that they may
There are a few. Yeah, of
eventually,
course
yeah, you
there's
may have identical twins,
yeah,
yeah.
yeah.
But it's not on all cases,
No, it's very rare.
Yeah, yeah, okay. And anyway, the current practice, I mean, like for just a common sharing, a lot of people who thought that IVF would end up with twins or triplet, it is not always the case. And currently, the worldwide practice is they are minimizing or avoiding transferring more than one embryos into the uterus so as to reduce the risk of multiple pregnancy. Because multiple pregnancies is equivalent with a higher risk, especially to the mother. Oh, okay, and then here I also have some other comments that says that this should be a topic included in marriage courses, and I have so many compliments that thank you Edmund and also Sui and also to Dr. Salim. So before we end this session, we only have 1 hour and we have a couple of minutes left. Dr. Salim, do you have any message that you would like to convey to all of us over here?
Yeah, when you're planning a family, just visit your friend doctor or whatever your family doctor and have a small discussion with the doctor. Talk about genetics, talk about the health concerns that you have, and include genetic as a small component of it at least. And if you want to get tested, you approach to a clinician and request for your test and get it done. Yeah, it really is important. because we are talking about an incidence of 1 in 600. You don't want to be surprised because every pregnancy is important for you, and when we're looking for a family, we're looking for a Nobel Prize winner. Everybody wants to have a healthy baby,
Yeah,
so yeah, you don't want to be surprised with a disappointment. Yeah,
exactly, exactly.
yeah.
So with this
But
kind of sessions where we discuss these kind of topics, then we help to spread the awareness also. Okay, so you have something
Mm,
to share also?
yeah, I'm just saying like on top of what Dr. Salim has mentioned, although we are given surprises, sometimes we actually should look at things in a different perspective. Our children are always a beautiful gift to us. There is so
Exactly.
much we can learn from them. They have actually, I would say, Brandon has actually brought so much beauty to the family and to everyone who knows him. He has made us see things so differently, and we have experienced extreme kindness and love from everybody. So no matter what situation we are thrown in, um, remember it's very challenging, and if we can do something right now, as I mentioned earlier, informed choices. But if it happens, it is not the end of the world.
Yes, definitely. Well, I'm very glad that today I'll be able to host these sessions where I myself also got informations from both of you, Dr. Salim and also Sui, and also that kind of spirit and tenacity and the positive vibes that I can totally relate. If let's say someone who is affected and we can place them in beside you, where you can give them that kind of thoughts, kind of positivity, definitely it will make so much difference to the affected family. And
Thank you.
in the future also, like for me, I wish that this kind of advancement or technology or whatever genetic testing it is can be made even more and more affordable, so that
Mm,
it can become like today regular blood test. Whenever we want to do, we just walk into the clinic and I say that, hey, I want to do a blood test, and just cost you like 100 over ringgit. It's so
mm.
affordable, not in terms of 3 digits, but of course that with the current technologies, with the
yes.
expensive for medias and etc., definitely the costs have to be covered. But we look
Yeah, the
forward to.
cost will come down as more samples comes in because when
Yeah.
we buy the chemicals and reagents, well, see, 5 years ago when we started offering NIPT, we started offering at 1,400 ringgit. But today, because our sample number has gone high, now we are reducing the price to nearly about less than 800 ringgit.
Yeah.
So it's affordable. Depends on the number of samples also.
Yeah.
Right.
Yeah.
What I understand from our counterparts in Taiwan is in Taiwan, a family who want to, I mean, a couple who want to start a family, they always ask for two tests, thalassemia and SMA, and
Oh.
through that awareness in the part in a few decades and all that, the number of SMA patients has really dropped because of a
Mm,
That's true.
carrier
Mm.
testing. Yeah, so I think awareness needs to go on, and we have to work together in terms of giving that kind of awareness to the public.
definitely. Yeah, so
Mm,
I'm glad today we have these sessions, and hopefully we will be able to share that kind of awareness and be educative to all the people out there, that they will make a more informed choices like what you said
yeah,
earlier. So thank you very much to Dr.
thank you.
Salif as well as Soyi who joined us in today's sessions. Hopefully we'll have more other sessions like this again in the future. And thank you also to everyone who have joined us in the live sessions today. Okay, so we shall end our sessions today and see you again in other opportunities. Thank
Thank
you.
Thank
you.
you.
Bye. Thank you for having us. Bye.
Thank you. Thank you. Bye bye.